Let's talk about health. The health disparities between African Americans and other racial and ethnic populations are downright striking. You can see it in life expectancy, death rates, and even infant mortality. According to the CDC, African Americans are more likely to die of heart disease and stroke, more likely to have hypertension, and black women are more likely to be obese. Merle?
Joshua Stampley-Gardner is the extreme of all those frightening statistics. To be sure, all races help to make up the bad numbers. But unlike most of us, this Rust College student has figured out that he cannot put it off any longer if he wants to save his life. 21-year-old Joshua Stampley-Gardner needs to lose 360 pounds in order to be out of the weight danger zone.
When I bought the belt in the store, they were saying that if I couldn't fit this belt, they would have to get special order.
Extra belt holes are a constant reminder that nothing tastes as good as success feels. His waistline is down from 85 inches to 64.
I didn't want to be another one of those young people with so much potential that's laying across the front of a church while people are standing over me. 6, 7, 8.
525 pounds. That's where he tipped the scales when his weight reduction plan started, October 2014. Or so he thought, until he visited the doctor. With all her resources, America hasn't figured out the 1-2 punch that can knock out obesity. The Centers for Disease Control and Prevention says 78 million U.S. adults are dangerously overweight, at risk of deadly diseases, and it's costing a fortune. Joshua's obesity battle grew out of love. His aunt had a routine reward, honey bun cakes.
And she would buy 2, and I would eat 1. And then she would say, 1 isn't good enough. Eat another one for TT. Eat the second one. And she said I would eat it. Not because I wanted to, but because they would want me to eat it. They would want me to have it.
The research seems to support what Joshua experienced. African Americans have a higher obesity rate than all other races.
How are you?
Josh, nice to meet you, man.
Dr. Ball.
Nice to meet you.
We were right there when Joshua visited a doctor for the first time in 7 years.
So let's see here.
Obesity puts even a young college student at higher risk of high blood pressure, heart disease, and diabetes. Dr. Ball's news is not great, but not horrible.
And so you're 537 on our scales. Yeah, so that puts you at over a BMI of 40. That's class 3, and so that does put you at increased risk.
537 pounds. All along, we all thought he had reduced down to 471. So this means that Joshua's scales were miscalibrated by 66 pounds. But the good news is his blood pressure is normal, 128/88, and no diabetes.
I still see the difference, though. And, so the scales probably were wrong. But I know that there's been improvement already.
Yeah, so do you know your body mass index, or BMI? It is the nationally accepted weight chart. This is it. This is what it looks like when you go online and you find it. We're going to help you to do that. It's nationally accepted. All it does is tell you what a healthy weight should be for someone that is your height and your size. Tonight at 9 o'clock, we will share where people at Fox 13 are. And we're also going to show you their reaction to the truth. So.